Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about one of the most common things we treat, which is plantar fasciitis or heel pain. It's so common that we're actually seeing people on a regular basis. I run into people at the store. Maybe I'm in an Uber and they're saying, "Oh, I have foot pain, heel pain when I get up first thing in the morning." And you kind of say, "Okay, are there any things that I can do, or do I have to go to the doctor?" So let me take a step back. Let me remind you exactly what plantar fasciitis is. Plantar fasciitis is an inflammation of the ligament on the bottom of the foot. So if you were to take a foot model, we'll use this here. You get the Achilles tendon attached on the back. You have the plantar fascia attached on the bottom. As you're walking or running, those are pulling against each other. The plantar fascia is weaker, gets inflamed, painful, tender, and starts to hurt. And so when you get up first thing in the morning, you can hardly walk. As you stretch it out a little bit, it gets a little bit better, and then worsens throughout the day. If you sit down, like say you get in the car and you drive to work, when you get back out, it's hurting again. Or if you sit down at work and you're not moving around, you get back up. Every time you sit down or lie down, the plantar fascia starts to heal, starts to pull back together, and then the inflammation gets worse and it starts to hurt more. So the question is, are there things that you can do at home, or do you need to go to the doctor? So we've talked about this before. We've talked about the idea that there's really two pieces to any type of plantar fasciitis treatment. Number one, you need to take away the inflammation. You need to decrease the inflammation, which will decrease the pain. Number two is you need to do something to solve the problem long term so it doesn't come back. Number two, we're not going to focus on right now. We're going to really just focus on number one, because that's what you will need to do at home to alleviate the pain, to give you back your life, and to have it not interfere. And a lot of times you can solve it in such a way that you may not need to be seen unless the pain continues or it keeps coming back. So alleviating the pain, decreasing the swelling. What are our options? The most effective and the quickest way to treat it is ice and anti-inflammatories like ibuprofen, Advil, Aleve, Motrin, those kind of things. Tylenol, of course, doesn't decrease inflammation, will not help the plantar fasciitis. As you decrease the inflammation, so if you were to ice the bottom of the foot, stick your foot in an ice bucket, or you put ice right on it, that will help. Even more effective, even better, is to take a water bottle and freeze it, because then you can roll your foot across it. As you're rolling your foot across it, it's massaging that area, and as you massage swelling, it also pushes it out of the area. So your ice is decreasing the swelling, massage is decreasing the swelling, and because of that, your pain starts to decrease. Anti-inflammatory, safe type of thing, what they're doing is stimulating the removal of the fluid from the area to decrease inflammation in that area. So ice, anti-inflammatories, especially if you can take a water bottle and freeze it and roll your foot across it. Other things that you will commonly do at home will be different types of stretching. Tomorrow, we will talk a little bit about plantar fasciitis stretching. I want to go in a little bit more depth, so I'm not going to talk about it here. But stretching, the focus of the stretching is on the Achilles tendon. You need to remember, the plantar fascia is a ligament, or a fascia in this case, which is very similar to a ligament. And because of that, it does not stretch. There are no stretches that will stretch the plantar fascia without making it more sore, without making it hurt more. So you need to do stretches on the Achilles tendon, and in so doing, you take the pressure off the plantar fascia. The third thing is wearing appropriate foot shoes instead of flip-flops. Certain types of sandals may be okay, but other types of sandals are not. Walking barefoot a lot when you have plantar fasciitis is usually not a good idea. The idea is you want something that will support the foot, that will not allow that plantar fascia to stretch off of that heel. So anything that allows you to flatten out your foot will make things worse. So you want to support that foot, put it in a shoe that supports it. If you have good padding in your shoes, sometimes that will make it more comfortable in the short term while you're working on getting the inflammation out so it doesn't hurt. So there are some things you can do at home. Ice, massage, anti-inflammatories, stretching, and appropriate shoes. This is Dr. Brandt Gibson, and this is your Podiatry Tip Day 106, treating plantar fasciitis at home. You can do it. There may come a point, though, where it's not getting better, or it's not getting better the way you want it to, and you should be seen by a doctor who can help you get rid of the pain, but also help you resolve this long term by giving you some treatments that will